So again, welcome everyone to the She Recovers Mental Health Monday educational series. I am so excited and honored to introduce to you our session topic and speaker. Today we will be learning about body-focused repetitive behavior disorders with Jean McCarthy. So skin picking, hair pulling, and other body-focused repetitive behaviors are a source of frustration and shame for millions of affected people. In this educational session, Jean McCarthy will share her personal experience with this disorder and discuss resources and methods for help. Jean McCarthy is an award-winning blogger, author, and podcaster who is best known as a voice of recovery advocacy. Jean writes the blog UnPickled and is also the producer host of the Bubble Hour. She has also written 2 books about sobriety. Jean also received the 2017 She Recovers Hope Award in recognition of her efforts to help others seek positive changes in their lives. Jean is also a fellow Canadian, so I like to just give my fellow Canadians a shout out. She does reside in Alberta. To learn more about Jean, you may visit jeanmccarthy.ca. So thank you very much, Jean, for being here.
Well, thank you for having me. All right. Well, I wanted to start by thanking you ladies for holding space for me to talk about something that's very vulnerable and I think important to talk about. And I wanted to just begin by setting my intention and sharing a poem with you from a collection of poems that I wrote. This poem is called Morning. I watch this newborn day unfold and promise myself I won't ask too much of it. After all, it's just a day. I won't expect to change the world or even myself today, but only nudge us both in a better direction. And that's my intention in sharing my story and my experiences with you here today, is just to give myself a little nudge and maybe you a little nudge and maybe our isms a little nudge. This is intensely personal and vulnerable, and I'm going to do it anyway because good things happen when we share our stories. So I think it's important that all of you are taking the time to just learn about something that many of us have been relieved to learn is actually a thing. Those of us who might have this thing think that it's just our thing, or maybe that we're especially weird or gross or shamefully different. But it's time to change those perceptions about ourselves by speaking openly and learning everything we can. So I come to you on this topic to share my experiences and what I've learned along the way, but speaking only from personal experience. So this presentation is not intended as medical advice. I'm not an expert. I am a woman in recovery sharing my experience for information and discussion. I'm humbled by and deeply uncomfortable with this opportunity to share what I've learned about a disorder that I have lived with since my earliest memory. So that cute little bean, that's me. And people always used to ask me what happened to my legs. So depending on what you're looking at this on, if your screen is big enough, you might be able to see that there are some little marks and sores on my feet and ankles. It was hard for me to explain to people that I liked scratching my ankles, especially in bed at night as I drifted off to sleep. It felt nice to me, and even though my feet and ankles were a bit of a mess in the light of day, I did it anyway. The sores on my feet caused adults concern, and other kids noticed them too. And so I got the message it was not okay what I was doing, and I began to make excuses like that I had mosquito bites or that supposed accidents or little stories to explain how each of those scrapes came to be. As I got older, I tried to stop the behavior because I didn't like people noticing it, but I just couldn't stop. And the scratching was so soothing, and it happened almost as if by rote. I didn't even know I was doing it. In my teens, I became deeply embarrassed, and so I transferred that habit of excoriating my skin up to my scalp, where at least it was covered by my hair. But it would be decades before I learned that this behavior, for which I felt a lot of shame, had a name. So it's called body-focused repetitive behavior. And oh, you can tell I'm Canadian by the way I spell. I'm guessing a lot of you are American, so enjoy the extra S's and U's that Canadians like to put into all of our words. So body-focused repetitive behavior, or BFRB, and it's classified in the DSM-5 as part of the spectrum of OCD related behaviors. And although it is separate and distinct in many ways from OCD, it requires different treatments than your typical OCD, which stands for obsessive compulsive disorders. So we'll just start with the basics here. The main three forms of this disorder comes in the form of hair pulling, which is called trichotillomania. And when you break that word down, trick means hair, and tillo means pull, and mania means frenzy. So it's a hair pulling frenzy. And it can occur in sort of short bursts throughout the day or in longer sessions lasting an hour or more. Often people that have the disorder of trichotillomania will pull on their hair on their head or their eyelashes or eyebrows. Another form of this is called dermatillomania. And again, if we break that word down, derma, skin, till is pull, mania is frenzy. So it's a little frenzy of pulling at the hair. And it used to be called that more commonly. Now it's more often known as excoriation disorder, and it means picking at the skin. And this can be usually on the hands, lips, or scalp, the nails, the cuticles, or the fingers. So that can also, the nails and the cuticles is another form, which is called onychotillomania, which again, we break that word down and it's easy to see what it means. Now there's a secondary category to each of these as well, which affects a portion of people that have the pulling disorder or the picking disorder, and that is the compulsion to either chew or swallow whatever it is that they are removing from themselves. And so that's pretty common. Most of us are familiar with that when it comes to nail biting or chewing of the cuticles, but it's important to understand and speak plainly about the fact that that compulsion, that seeking for comfort, can also come from chewing hair or from chewing skin. And it's difficult to talk about that without registering a reaction. But I think that it's really important to talk about it because for 15% or more of the people that have these disorders, they also include that secondary phase of it. And it's not understood by others as being a comfort-seeking compulsion, but that's really what it is. So I think we need to also mention that, you know, everybody has self-grooming habits that are private and maybe that they feel are a little bit gross. Like everybody pops their pimple or uses a finger to clean their nose on occasion. They chew on a hangnail or remove the scab occasionally. Most people also lie about this, by the way. So studies have shown, for example, that 90% of people do actually pick their nose in some way, shape, or form, but only 20% of people admit to it, and that is mostly little boys who haven't been taught yet that they're not supposed to. So how do we know the difference between what's just sort of normal self-grooming and sort of private habits? When does it cross the line into being the actual disorder? And so what I've learned is that what makes these disorders different is that they aren't just your typical grooming habits. They result in physical and psychological damage, and they also consume a lot of time. They persist despite wishing to stop. There are efforts to conceal the behavior and the damage that it causes, and there's persistent shame and possibly even changes in social interactions or lifestyle as a result. And yet, it's also important to notice that it might be more common than a person thinks. And so it's estimated that 22 to 24% of the population are affected by this disorder. Rates tend to be higher among women than men, and it would be my guess that in a crowd of women who identify as being in recovery from something or anything, the rates among us might be even higher than that, because we tend to also identify as having higher rates of anxiety, and also be a little more open and forthcoming in talking about the things that we are concerned about ourselves, and we're less invested in hiding and shame. So that can make a bit of a difference too. So for me, as a person with excoriation disorder, knowing that 2 to 5% of the population has this, when I feel like I'm the only person in the world and that no one else would understand, or that there's something especially wrong with me, I can look around, in a crowded room. Back when we were in crowded rooms, right now we're in COVID, so there's not a whole lot of crowded rooms. But anyway, you can look at a crowd of people and know you're definitely not the only one. In a room full of people, there might be 20 other people that experience the same thing. And so that is really helpful for me to know. We can also just see from the numbers that it is really the nail biting and the nail picking that is really highest among people. So we're definitely not alone. Another question that I was asked recently is a body-focused repetitive behavior self-harm? Now, in the past, in other interviews, I have actually indicated that I believed it was a form of self-harm, because that is what I had been taught, and that is what the information presented earlier used to say. But now, studies are really starting to realize that that is not the case. So it used to be thought to represent rage that was directed inward at a person, and now I think studies are starting to show that that may not be the case at all. New research indicates that for the person affected, the action is usually rooted in trying to improve the nature of the affected area or in seeking comfort. So something like an uneven nail edge or dry skin or a wayward hair could be something that is sought out and removed for improvement or comfort. Those who engage in body-focused repetitive behaviors typically do so to relieve stress or to experience gratification from other sensations. And that was certainly my experience, is that it just felt nice as a little kid, and it was something that continued on. So that contrasts sharply with people who self-mutilate intentionally to cause harm, or to punish or attempt to distract themselves from intolerable emotions. So in that regard, body-focused repetitive behaviors don't appear to be a form of self-mutilation. They're separate and distinct disorders, but they do kind of look that way to someone looking on at them, because it appears that the person is trying to hurt themselves. But the experience from inside of that person is that they are comforting themselves. It tends to be comforting behavior rooted in anxiety. And I would say that as a woman in successful long-term recovery from alcohol addiction, I personally feel that there is a direct correlation between my reliance on anything that offers me comfort, whether it's wine, which it isn't anymore, or endorphins from excoriating, or chocolate. I'm just really easily addicted to anything. I'm jumping around, and so I'm worried I didn't read this part. Forgive me if I did, but I'm going to share it again. So there's a tiny bit of endorphins that are released when a person pulls a hair or removes a bit of skin. And so some researchers believe that that cycle of endorphin release is similar to the cycle experienced in self-harm, even though they have different origins. So that could explain why both of those patterns feel sort of addictive, is because there is a endorphin cycle associated with them. So the cause of body-focused repetitive behaviors is unknown, but there does seem to be a genetic predisposition for it. And other factors involved include temperament, environment, the age of onset, and family stress factors. So what are the treatments? What can we do about this? Well, as a disorder, this is still being understood, and treatment is improving, although there's currently no simple antidote. But take heart, because there are effective ways to deal with this. It doesn't just go away on its own. There is absolutely no magic pill, but with support and therapy and workarounds, I've learned that you can see significant improvement. So first and foremost is awareness and knowledge. And the website that I rely heavily on for information is bfrb.org. Medication, I wish I could say that there was a simple pill to fix it, but as of right now, July 2020, there just isn't. There's currently no medication approved for the treatment of BFRBs, but doctors do prescribe antidepressants, SSRIs, tranquilizers, and antihistamines off-label in an effort to try and deal with some of the surrounding factors of the disorder like anxiety or itchiness. And these treatments have some success, but it's limited. Currently, therapy is considered the most effective treatment, but it's difficult to find practitioners that are trained in treating BFRBs. So some of the therapies that are considered to be quite useful are CBT, cognitive behavioral therapy, and this is a term most of you are probably pretty familiar with. So that focuses on identifying thoughts and feelings and behaviors in order to change the way that a person responds. Then there's habit reversal training, which combines awareness of the urge, creating new responses, and social supports to help the person. And it seems to work better in short-term changes than long-term. There's awareness and commitment therapy, or ACT-enhanced behavior therapy, and that is being aware of the urges and increasing tolerance for them. And it focuses on making the behavior more difficult in some way rather than controlling the urge to either pick or pull or whatever the behavior is. There is a theory called the comprehensive behavioral model, or COM-B, and it assumes that the person is engaging in the behavior because it meets a need, whether it's relaxation or sleep or a feeling of improvement in some way. And this model focuses on understanding why and where and how a person performs their behavior so that individualized interventions can be developed and that you can somehow learn to attain that need or that goal without the use of that behavior. So it focuses on 5 main domains: the sensory, cognitive, affective, motor, and place. So essentially the why, where, and how of the behavior. And then there's dialectical behavior therapy, and that uses mindfulness, emotional regulation, and distress tolerance as a way of treating the disorder. Group support, hey, I don't have to tell this group that there is power in connection and in finding, storytelling, holding space, and learning from others. Yeah, we know this. We know the power of this, and this certainly extends to something like a BFRB. Online groups are emerging now, and that is good because many of us have a hard time finding information within our own communities. So there are groups for adults, children's, teens, and family members, and they're all available on bfrb.org. Social support is a little bit different than group support, so that is enlisting family members or friends to be part of your support team. And it doesn't just mean that they slap your hand whenever they see you, scratching or pulling your hair. It really means that they make an effort to become informed and compassionate about the disorder. So many Many well-meaning family members might use outdated tactics like scolding or shaming that actually make things worse and not better. But when they educate themselves about what actually is helpful, compassion and education are the key. So there is specific information available for parents of children with BFRBs as well, and that can be age specific, and there are support groups as well to connect online with other parents that are looking for ways to help their children with this. And then there's alternative therapies, and this really could be a whole category in itself because for me, I find this to be really so helpful. So they encourage things like hypnosis, massage, and diet. There is also nutrition and other types of therapies as well. So The TLC Foundation for BFRBs is the organization that has created BFRB.org, and I'm not affiliated with this group, but it has just been so helpful in my own experience that I'm talking about it a lot here. It's a fantastic resource. They note that there's new interest in an amino acid called, see if I can get this right, you guys, N-acetylcysteine, or NAC, that I can say, NAC. A recent study showed it to have helped lessen urges for half of participants, and that is very promising. So there's information about that as well that you can seek out or talk to your doctor or your nutritionist about. So in my personal experience, and let me be clear that I don't endorse any particular treatment and I'm not a medical expert, my number one method of managing the disorder myself is to keep my nails done with tips and acrylic or gel coating. And I'll just hold my hand up so you can see it. So they're not exceedingly long, but they're just enough that the edges are not sharp. So it makes them dull enough that I can't actually do damage and break my skin. Diet is extremely important to me. I have some food sensitivities that affect my skin, and having a flare-up of skin issues sets off a cycle for me. And I am trying the amino acids and as well as hypnotherapy, and it's really too soon to tell you whether or not these are producing results, but I can say I'm finding hypnotherapy to be super enjoyable and relaxing, and that's something that I definitely can use more of in my life. So here's something else that has been simple but very powerful for me, and that is the use of language. So I say name it, don't shame it. So rather than using language with myself or with others that say things like I pick at my skin, that makes me feel shameful and puts the focus on me. Instead, I'm learning to say I have excoriation disorder. Or when I'm doing the behavior, I might say to myself, I am excoriating, I am symptomatic right now. And that puts attention on the problem, which is a disorder, a thing for which there is a solution. So there's a behavior chain associated with a body-focused repetitive behavior, and understanding it and disrupting it is helpful. So the language that I use to think about it, even just to myself, is one of the early steps and powerful in disrupting the cycle. So body-focused repetitive behaviors are understood to be a chronic condition with stages of remission and relapse. So for me, what this means is that it's something I will likely manage throughout my life rather than eliminate and conquer. And I'm okay with that, as long as I'm managing it and not being dragged around by it. During the early stages of the COVID pandemic, when our community was on lockdown, I experienced a progressive spiraling relapse of my BFRB, a combination of stress, diet, and lack of access to my usual strategies. And as soon as I was able to get back to using my typical strategies, which is to say to get my nails done and to visit help and to eat properly, things improved, and currently I'm in what I would consider a state of remission, which for me is not a total absence of symptoms, but a feeling of managing them. So I want to finish this presentation with one more poem that I wrote, and the poem is called Truth. And I have to wear my glasses to see this one because it's little. Truth. A truth emerged, suddenly there, filling an invisible void with utter understanding. It took the place of unexpressed disappointment, lack, and resentment, shifted with a click of alignment, relief from discomfort disguised as personality. It cannot be unknown, this truth, this insight, this wisdom, and who would surrender peace once given? Tucked into a pocket, a guarded treasure, touched for reassurance. It is mine. It found me. I'm grateful. So I want to thank you for your time and for holding space for me while I nervously tell you everything I know about body-focused repetitive behaviors. Once the recording ends, we can have a private session of questions and answers and discussions. And I thank you all so much.
Amazing. Thank you so much, Jean, for your energy, for your courageous vulnerability, and being willing to share your personal story as well as, you know, your expertise and all of the research that you've done on this topic. I can see that is just resonating deeply with our community, and I certainly appreciate that.
That means a lot to me. Thank you all.